Okay, my name is Denise Lewis, and I'm going to be demonstrating the checkoff for the Enteral and Injectable medications. So the first thing I'm going to do when I come into the medication room is I'm going to wash my hands. Then I'm going to take a look at my medication administration record. I'm going to make sure I have the correct patient. I'm giving medications to Stella Bellman. And her date of birth is 2/6/41, and these are her medications here, and I'm going to make sure that I check each of the medications as I prepare them. So I'm going to use the 3 checks and 5 writes. So the first medication I'm going to be giving is acetaminophen. I'm going to take a look at acetaminophen, and it is an elixir, so it's going down her G tube. So I have acetaminophen elixir, 160 milligrams in 5 milliliters. I'm going to have to do a little bit of math there. So I know I'm going to be giving 320 milligrams, so 10 milliliters of this medication. That is my first check for Stella Bellman. My second medication is going to be insulin, regular insulin. I'm going to take a look at my vials and find my insulin. And here's my insulin, and I'm going to be giving 12 units of regular insulin subcutaneously for Stella Bellman this morning. So that's my first check on the insulin. My third medication is going to be lisinopril, and it's a pill, so I'm going to have to crush it. And I'm going to be giving lisinopril 40 milligrams by G-tube for Stella Bellman this morning. So 40 milligrams. So I'm going to set that right here. So that is my first check. All right, now I'm going to do my second check. So I'm going to again look at my medication record. I still have Stella Bellman. I'm going to be giving her acetaminophen elixir, 320 milligrams. There's 160 milligrams and 5 mLs in this bottle. So I'm going to be giving her 10 milliliters. So I'm going to give it a little bit of a shake here, and I'm going to prepare my cup to be able to give the medication. And unscrew that, and I'm going to get at eye level so that I can make sure I give the appropriate dose of medication. So I'm giving 10 milliliters. If you like, you can actually mark the cup at 10 so it's easier for you to see. So I have 10 milliliters of acetaminophen, which is 320 milligrams. I'm doing my second check, and I'm going to also put a label on this because I need to scan it at the bedside to do a triple, quadruple check. So here's acetaminophen. It's labeled and ready to go. My next medication is, and it's a second check for my insulin. I'm going to be giving 12 units of subcutaneous insulin. So I'm going to make sure I choose the right syringe, and all types of syringes are here for me. But I know this is my insulin syringe, so I'm going to have that ready. I'm going to get an alcohol wipe, and I'm going to clean the top of my insulin vial for 15 seconds and let it dry. And we'll say that's 15 seconds for the sake of time. All right. And then I'm going to draw up 12 units of air, as you guys have learned, to inject into my vial. Going to drop 10 units, 12 units. There's 12 units of insulin. And again, I'm not going to, I got to recap this needle because I'm going to be taking it to the room to inject the medication, slowly but surely. And then I'm going to place a label on my insulin because, again, we need to scan at the bedside. I'm going to put the label down low. Here we go. Insulin regular. So the last med I'm going to be giving is lisinopril, 40 milligrams, and I'm going to be having to crush that medication, giving it to Stella Bellman for her morning medication. I'll get my crusher ready. And again, that's lisinopril, 40 milligrams. I'm going to give her 1 pill, because again, the dose is 40 milligrams. It's given as 40 milligrams. I'm going to put that one pill into the crusher. I'm going to crush the medication. And I hear it really crunch. And I'm going to have my other cup here and put that medication in here. I would wash this once I was done. So I'm going to go ahead and label this medication with lisinopril 40. I'm going to put that on the medication. All right. So now I'm going to do a third check. So I have my stock med acetaminophen, 160 milligrams, 5 milliliters per 160 milligrams. I'm going to give 320, so 10 milliliters. I have 10 milliliters here that I've measured out for the patient, and I'm going to put this back into the stock. So I'm also going to put this into the transport little bucket there. Then I have insulin, regular insulin, 12 units subcutaneously for Stella Bellman. Okay, we got regular insulin, that's what we have, and that's what I have here, and I drew up 12 units. So I'm going to set that into the little bucket, and I'm done with that. Then lastly, my third check, I'm going to check lisinopril, 40 milligrams, and I'm checking all these things, of course, before I go back to the room, because I've had to crush this, and the other ones are, the other one is liquid and an injection. So lisinopril, 40 milligrams. I've already crushed that. I have it labeled, and that's going to be for the G-tube. All right, I'm going to make sure I have the proper equipment with me, because when I look at the lisinopril, it says on the MAR that I need to make sure the patient's blood pressure is at least more than 100/60. So I know right now I'm going to have to take my blood pressure cuff and my stethoscope. I'm going to step over and get that. So now I show that I'm prepared to be able to check the proper vital sign. All right, then I'm going to take my medication and take it over to Stella's room. I'm going to be going to Stella's room now. I've already prepared all my medications. And I'm going to leave the curtain open and check off. You will close this curtain when you're doing your check off. All right, I'm going to knock on the door. Knock, knock, knock.
Come in.
Hi, Stella. How are you?
I'm good. How are you?
My name is Denise, and I'm going to be your student nurse today.
Nice. Nice to meet you.
I have your morning medications. I just need to do a couple checks and verify who you are before I give you the medication.
Sounds like a plan to me.
Okay. So, get my screen up there. All right. All right, Stella Bellman, can you tell me your full name and your date of birth?
Stella Bellman, 02/06/1941.
And Stella, do you have any allergies?
I have no allergies.
Okay, great. All right, and that checks with the MAR that I have in front of me, so that's perfect. All right, I have a few meds for you. They're all going to be going through your gastric tube.
Okay.
All right, so I'm going to start with acetaminophen. All right, and we have acetaminophen, 320 milligrams. Great. I'm going to go down and I'm going to scan your arm again because we need to make sure we verify. All right, and I have Stella Bellman. Great, 2641. Now I'm going to scan the medication. Sometimes it's picky. There we go. And we're giving acetaminophen. All right, perfect. And I have the right dose. I'm just verifying my 5 rights, the right route, and I have the right time. We're giving you the medication is scheduled this morning. And there's one thing I need to do to make sure I give you these medications safely. It's more the next medication I'm going to give, but I want to go ahead and check your blood pressure.
Okay.
All right, checking the blood pressure.
And blood pressure is 140/90 according to the machine.
All right, so your blood pressure is 140/90. I'll make a note of that, and then we'll make sure we give that medication safely. So I did do a second check. In addition to your name, I also asked you for your date of birth. I'm going to check that. And then that's really it. So now I'm going to come over here, and I need to give these medications to your gastric tube. So of course I'm going to have gloves on. Going to get a few pairs. Going to place the medication here. All right. All right, great. So first thing I want to do is make sure that your gastric tube is patent, and it looks okay. So what I'm going to do is take a look at your site. Looks nice and clean, no problems there, okay? And then I'm going to aspirate and make sure that the gastric contents is received. All right, we have gastric contents. Going to go ahead and put that back in there. Make sure I clamp as I open and close the G-tube. All right. Going to prep a few more things. I'm going to put about 150 milliliters of water in my graduated cylinder because that's what I'm going to be using to flush the medication and the G-tube with. All right. Now I'm going to take out the plunger. All right. First thing I'm going to do is flush the G-tube with 15 to 30 milliliters of water. So I can see my measurements on my syringe. All right. I'm going to allow that to go into the patient. It goes in nice and easily, so it's flushed. Now I'm going to take my acetaminophen that I've already verified and place that in there. Let that go in. Goes in nice and easily. Then I'm going to take another flush. 15 cc's, milliliters. All right, so that medication is done. I'm going to take this out, and again, I'm clamping, making sure that I keep a little clamp on that. Now I can release it because now the tube is closed. So now I'm going to head over to the patient again. Whenever you take on and put off gloves, take off gloves, you're going to sanitize. I'm going to simulate that just because of the sake of this changing your gloves multiple times. You're going to be doing the same thing. So now I've taken off the gloves, I washed my hands. Now I got to come over here and I need to make sure I show that I have administered the medication. So here it says administered. And you guys are familiar with this look of the MAR because you've been practicing. So now I'm going to go on to the second medication. Anytime I have my hands on the computer, you see I don't have gloves on. I've washed my hands and I have my hands only. So now I'm going to give her insulin. So same process. I'm going to click administration. I've already checked her. Her ID. I don't need to keep redoing that. Now I just need to scan the medication barcode. So I have my insulin. Got my scanner. Gonna give it another scan. Oh, we got lucky the first time. So we have our 12 units of insulin that I'm giving Stella. So again, I'm gonna do my 5 rights. I have the right dose. I have the right route. I have the right time. I've completed my checks, my 3 checks, and I've asked her for her date of birth for her secondary identification initially. So I'm going to give the insulin. So again, I'm going to place my gloves. I'm going to come over to her belly. And again, we're going to simulate right here. All right, and I'm going to take my alcohol. And I'm going to clean really well in and out. All right, and let that dry. We never fan. So now it is dry, and I'm going to give her sub-Q 12 units insulin. Going to give it a little pinch, 45-degree angle, inject, and out. I'm not going to recap this needle. It's a dirty needle. Going to place it into the sharps container that's at the bedside. Okay? All right, so that is done. So now I'm going to take off my gloves and sanitize, and I'm going to document. All I'm documenting is that I gave the medication. And charting and DocuCare, you can also put down the location of where you put the injection. So I'm going to click Administered. We're done with that one. Now we move on to this last medication. So as I do the verification part of things, I'm going to go ahead. This is my crushable lisinopril. I'm going to go ahead and place some water into that. I'll use the water I've already poured. Sort of let that settle while I do the remainder of the documentation here. All right, I'm going to scan the medication barcode. We've already checked Stella's identity. All right, there we go, lisinopril. I checked the right dose, the right route, and we're giving it at the right time. So I've done my checks. And the secondary check I did was birth date. And this is where I'm going to make sure I document her parameter, her blood pressure. And when I did her blood pressure, it was 140/90. So I'm going to document that. Then head down here, put this aside, put on my gloves, and now I can access her G-tube again. So there's about 3 changes of gloves in this checkoff. All right. You can take this and actually stir it up a little bit. Just stirring up the medication. Your stimulated medication does not mix like regular medication, so just so you know ahead of time. All right, so now I'm going to clamp her G-tube. Open it up. I flushed after the last time I gave the other medication that I gave first. I'm not going to flush again, not necessary. Going to attach my syringe, and I'm going to push the medication in. Sometimes I stop halfway and sort of do it a little swish. So that helps get the medication out. Okay. Going to let that medication go in. Do another flush. You can help it along if you need to. All the medication is in. And if you'd like, you can give all the water. We're going to do that today. We're going to go and give the rest of this water. Because you're also going to be documenting I&O. So we've given 150 milliliters of water along with her medication, which was 10 milliliters, so 160 milliliters of fluid for the intake. So that is done with this. I'm going to take off my gloves. And I'm going to document. All I need to document is that I administered it. I've already done the leg work beforehand. All right. And that is it on the medication part of things. You also want to go into your I&O tab, and you want to document your I's and O's. So we're looking at intake for this situation. So we're going to record intake. With today's date, we're going to select the type of intake. And some people put tube feeding, but I put other flush, intake flush, intake fluid, excuse me. And then I also put G-tube, typing gibberish. G2 flush. All right. And then we know it's 150 flush and 10 extra milliliters for that acetaminophen I gave. And then I'm just going to go ahead and click save. And that's going to save that into the patient's intake. All right, so then I'm going to make sure that I place Stella Billman's bedside table back where she can reach it. Make sure Stella has her call light. And Stella, do you need anything else before I leave?
Nope, I'm good, thank you.
I'm also going to keep her sitting up at this 30-degree angle to make sure, at least for 30 minutes to an hour, and to make sure everything's okay after her G-tube administration. And that will be it.